Okay, why don't we get started? We're really excited about today's round. I want to thank all of you for joining us on this Friday noontime for our VCH Icon Indigenous Health Round. My name is Kendall Ho. I am a emergency physician at Vancouver Coastal and also the lead of the Intercultural Online Health Network at the Department of Emergency Medicine at UBC. I'd like to acknowledge that this session today is occurring in British Columbia, and also for myself, I'm calling in on the shared, unceded, ancestral, and traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh people. I'd like to invite you, if you like, to use the chat to share where you are, and if you would like to acknowledge where you are located, we certainly would be very welcoming of that. We're very, very fortunate today to have Dr. Elder Roberta Price and also Dr. Colleen Varko joining us today to speak to the topic of intergenerational trauma and the impacts of colonial history on the health and well-being of Indigenous people. Personally, I'm absolutely looking forward to this session so that I can do a lot of learning. And I know that we have two wonderful speakers and wonderful sharing of their perspective. So for today's session, what we'll be doing is for the first 40 minutes or so, that we'll have the presentation. And then for the rest of the time, it will be an interactive session. And so please use the chat room. If you have any questions at any time, please type your question in or your comments in. I am co-moderating this session with Janice. And so momentarily, I'll also introduce Janice from our VCH Aboriginal Health Unit so that we will alternate and speak to your questions. And we'll invite Dr. Elder Roberta Price and Dr. Colleen Varko to provide the responses and discussion together on this. And I know that this session is set for till 1:30 p.m. Pacific time. And we also know that many people may have to depart at 1 p.m. So that's why we have at least 20 minutes of interaction till 1. And for those of you who can stay, we absolutely welcome you to stay till 1:30 to join us to continue this conversation together. So really appreciate that a lot. This session is recorded. This is so that we can, many of you, I want to first say many of you are old friends coming back. So we really welcome you back in this dialogue. And also many of you are new friends. I hope that will continue to welcome you to this session. I know today we actually have quite a record number of people registering for the session. So we're very excited about that. And so the recording is so that we can put it onto the website so that we can share with others. And we have been very fortunate for our previous sessions. There are a lot of viewership of this. I think there's many things that we can learn from it. That's the reason for the recording. So I just want to bring that to your attention. I also want to acknowledge that this is clearly a wonderful partnership for us in the Department of Emergency Medicine, together partner with the Vancouver Coastal Health Aboriginal Health Unit under the leadership of Leslie Bonshore, and also in partnership with Ministry of Health in the Primary Care Division Patients as Partners branch. And so momentarily, I'll be inviting Sherry Barr, who is the Senior Provincial Primary Healthcare Advisor in the Primary Care Division, BC, to welcome you. And also, I want to bring you greetings from the First Nations Health Authority, Dr. Terry Aldrich. She, as many of you have been before, she's been one of our speakers and also join us in welcoming all of you here. Unfortunately, today, she's unable to make it to this session, but would like me to extend a word of welcome to all of you. And so with that, I'd like to extend it to invite Sherry to give your word of welcome. Sherry, thank you very much for being here, and let me pass the Zoom to you.
Thanks, Kendall. Thanks for the opportunity to give the opening remarks. Much appreciated. I'm Sherry Barr, work in the Ministry of Health in Patients as Partners. And I'd like to acknowledge and offer respect to the Lekwungen speaking people on whose territory I'm located on today in Saanich. Patients as Partners works by the motto of nothing about me without me. And we believe that engaging patients and their families, healthcare providers, and community partners is not only the right thing to do, but it is the way to make the health system better. And Patients as Partners has collaborated with ICON for over 10 years, and they've brought hundreds of people together to learn about managing chronic diseases. Now, how did they do such an amazing thing? They speak to people in their first languages on topics that people want to know more about. And they collaborate with numerous partners. A number of years ago, Kendall came to Patients as Partners with an idea. And it was, as a doctor, he wanted to learn more about how to incorporate traditional Indigenous healing into Western medicine. And we thought it was an excellent idea. And so we asked him to start with it. And they've been doing a fabulous job, bringing people together for discussions such as the one today. And I invite you to check out their other resources and the patientsaspartners.ca website for other resources as well. I'd like to give a huge thank you to the presenters today. I'm very much looking forward to learning more about this very important topic and hearing about your experiences. Thank you so much.
Thank you so much, Sherry. I feel very, very fortunate to be able to participate in this. And I really want to thank the Vancouver Coastal Health Aboriginal Health Units and the wonderful partnership with Leslie. And so I'd like to now introduce Janice Wardrop. Janice is one of the senior leaders in the VCH Aboriginal Health Unit and also co-moderating this session. So Janice, let me pass it over to you.
Thank you, Kendall. Thank you, Sherry. Hot squals all. Haichka, thank you for being here. We welcome you all. Janice Quiansna, Kaslas Quenesqui. My name is Janice Wardrop. Also Kaslas. I am calling in and joining you all from the beautiful unceded ancestral territories of the Squamish and Tsleil-Waututh people. Myself, I am Squamish and Kwantlen, Native Hawaiian and mixed European myself. Super excited about today's session, and I love working with this group, ICON, and all our partners. It's going to be a wonderful day. Thank you so much, Colleen and Elder Roberta, for joining us. What an honor to have you. Yeah, my role is as Director of Indigenous Cultural Safety at Aboriginal Health. So enjoy the session.
Excellent. Thank you, Janice. I'm not going to spend any more time except to go directly to welcome our two speakers and get them starting with an excellent presentation. I'll take 1 second to thank all of you who have in the chat do your acknowledgements. I continue to welcome you to do that, and thank you so much for joining us from all parts of British Columbia here. We're very honored to have Dr. Elder Roberta Price and Dr. Colleen Varko as our guest speakers today. Dr. Elder Roberta Price, I had the pleasure of knowing approximately 3 years ago, and she is a Coast Salish heritage from the Snuneymuxw. I apologize, Elder Roberta, if I mispronounce it, and also from the Cowichan Nations, is an elder advisor and research partner at the University of British Columbia School of Nursing. Dr. Elder Roberta has been involved in studies related to structural and interpersonal violence and trauma and their effects on healthcare access and quality of Indigenous people. In 2021, she was awarded an honorary doctorate of laws by the University of British Columbia in recognition of her work. Welcome, Elder Roberta Price. I also want to introduce Dr. Colleen Varko. Dr. Varko is a professor at UBC School of Nursing. She is of Indigenous from Cherokee and also immigrants from English heritage. Her work aims to decrease inequity and violence, including interpersonal and structural forms of violence, such as racism and poverty. She has studied how to promote equity-oriented healthcare, including cultural safety, harm reduction, and trauma and violence-informed care. At the organizational level, she looks at that and also work with Indigenous communities and organizations in healthcare and criminal justice context. That's why I get so excited. I can't wait. And so right away, I'm going to invite Dr. Elder Roberta Price and Dr. Colleen Varko to start their presentation.
OCM, thank you to each and every one of you who have spoken so far. As taught to me by my elders, I'll start us off in a good and respectful way. Haichka, Siem, Siaya, greetings and welcome everyone. As Coast Salish matriarch and elder, I wish to give a very warm thank you to all my relatives on the Musqueam, the Squamish, and the Tsleil-Waututh for welcoming me to live in the unceded lands of my relatives, Musqueam, in Richmond for 41 years now. As Coast Salish matriarch and elder, I wish to give each and every one a very warm welcome who live, work, and play, give and receive service, teach and learn on our unceded, ancestral, and occupied lands of my relatives, Musqueam, Squamish, Tsleil-Waututh. Always honoring and following in the footsteps of my beautiful mentor elders, Elder Vince Stogan from Musqueam, Elder Bob George from the Tsleil-Waututh, and always following their guidance and their teachings. Thank you for listening, everyone. Start us off with a blessing and a prayer. Thank you. Haichka, OCM. We give you many, many thanks, Creator, for bringing us all together in this very wide virtual circle of Zoom in a beautiful, respectful, and kind way. We ask, Creator, that you bring blessings down upon our minds, our hearts, our bodies, our spirits. So when we think our thoughts, they are good, positive, and respectful. When we speak our words, they are good, positive, and respectful. We call upon you, Creator, to bless the people who prepare the food, bless the food and drink we put in to nourish our bodies on our journeys to wellness and strength. We give you kind thanks each and every day, Creator, for the special blessings of protection you bring down upon all the beautiful people who are working so very hard in so many ways during this pandemic, for all illnesses, for the safe delivery of our grandchildren and our great-grandchildren, and especially for the ongoing opioid crisis. Continue to bless and protect them and their families, Creator. And we ask for special blessings of protection, of peace and comfort down upon all our relatives right across Turtle Island who have reopened wounds and are grieving all over again over the media releases of this past year. Please bring peace and comforts onto their hearts, their minds, their bodies, their spirits, Creator. We kindly and respectfully ask you, Creator, to wrap each and every one of us and all of our loved ones in your warmest blanket of protection as we all journey through this part of the journey of our lives together. Help us each to keep safe in our travels, both near and far, Creator. And we always give you many, many thanks, Creator, as we ask you to bring all of your blessings down upon all the ones that are hurting, all the ones that are grieving, all the ones that are hungry, all the ones without homes, and especially, Creator, all the ones that are hurting, all the ones that are grieving. Haichka, OCM. Thank you so much, everyone, in honoring the teachings of our elders and our ancestors. And now I'll pass the cedar bough over onto you, Colleen. OCM.
Haichka, OCM. Thank you so much, Dr. Elder Roberta. Just so lovely to be with you, and even though I'm not with you. So, and thank you, Dr. Ho, and everyone else that's spoken for the kind introduction. I'm going to see if I can figure out how to unhide my slideshow here. There, hopefully I've succeeded. Have I succeeded? Yes, okay. So just lovely, thank you very much for inviting us. I think it's it's a great opportunity, and I was just having a look at the faces I hear, even though we're coming from many different places, and I think we're all joined in this work together. And we were originally asked to speak about intergenerational trauma and the impacts of colonial history, and I think that we really wanted to make the point that it's not in the past, that the intergenerational impacts not only live on in the bodies of people, on the minds of people who have experienced such tremendous trauma and colonial disruption, but also let me know, am I audible? Because my internet's unstable. Am I okay? Could somebody let me know?
Colleen, you are coming in and out a little bit.
Okay.
So if it's stabilized, that's great. We're so far still hearing it okay, but from time to time you slow down a little bit.
Okay, I'll turn my camera off if you would signal me. I'll keep my eye on you. Thank you. Okay, so first of all, a lot of you have indicated, you know, where you are coming from, and I want to say that it's not just where we are, but who we are. And so I want to begin by saying that I'm coming to you from unceded Stolo territory. You're looking down at my farm, which is the yellow farm in the center of the screen there. And this is at the confluence of the Fraser and the Harrison Rivers. I'm on Scowlitz, and you know, my commitment is I am now moving away. I'm moving to the Shisha people's territory, and my commitment is to try to learn much more than I did about the Stolo territory, and find ways to support you know, whatever treaty negotiations, wherever people are at. So I'm going to challenge you later in our talk to look at ways that we can extend when we make our land acknowledgements, that they never become rote, that they're always coupled with a commitment to action. So I think that we are all coming to this work as raced, class, gendered people. And I think it's so important to me that we acknowledge our history and our ancestors, but that we only are focused on, not only, but that we're really focused on our own actions, because a lot of times people spend a lot of time focused on, you know, their shame and grief over what ancestors have done. And I think we want to think together about how to move forward. So Dr. Elder Roberta and I want to also acknowledge all of our teachers and the fact that we've got teams and teams of people standing with us. So we did kind of negotiate these goals with the team here that sponsors this work. And we do want to talk about colonial history and intergenerational trauma, the impacts, how these intersect. But what we really wanted to focus on is two things. One, making sure that we're all thinking about contemporary forms of colonization and racism, and really focusing with you on what can we do about it, because of difference. So we want to focus on the so what and the how to. We are also coming to you with some assumptions, and one of the assumptions is that all of us are joined in a real commitment to taking action on colonialism and racism, and that each of us is somewhere on our journey, but in a different place, and that each of us has a role. You know, Dr. Ho's an emergency physician, I'm a nursing professor. We all have different possibilities within those, and so we can tailor to that. The you know, very importantly, the organizers asked us to make sure that we point to the fact that this, just even being here, can be triggering and very uncomfortable. We might say things that are uncomfortable, and particularly depending on your own background. might be quite triggering for people. We're going to try to do our best not to do that. But I wanted to acknowledge it. Many of us, at least half of us who identify as women around this room, have experienced sexual or physical assault. And, you know, we have less understanding of people of other genders, but we know that many of you around the room have yourselves experienced racism and all other forms of violence. So we wanted to acknowledge that and just say, you know, people keep their cameras off, go get a drink of water, tune us out, whatever. And also, I have always found that for myself, turning towards suffering is the answer rather than turning away in terms of healing and dealing with the things that I've experienced in my life. So, so I think that is a way forward. If you are at all interested in the concept of vicarious trauma and, you know, what can be done to prevent and support, we have a whole bunch of tools related to that that are on our website that you see there, and I'll be giving you that again. Just some tips on what people can do, either for yourself or for others with whom you work. So Dr. Elder Roberta and I are not just pretty faces. And so I wanted to tell you that we're drawing on our long history of doing research together. And it's not just what we've been researching, it's been how we've been partnering together that I think is really critical. So I was doing quite a bit of research around the issue of violence, and I started out studying violence against women. What are the health impacts over time, and how does women's health improve over time or not after they leave abusive partners? Because as you probably know, that's the solution that is given to women. And then Roberta and I partnered around looking at that specifically in the context of the experiences of Indigenous women. At the same time, Roberta had been partnering with our colleague Annette on equity-oriented studies, and really we all came together around trying to figure out how excellent care is being provided to people who are facing racism and poverty and you know, enormous challenges, and yet some healthcare settings really do an excellent job. So we learned from all of these things, and in two further things that we've partnered on, we've developed a intervention, a health promotion kind of support for women experiencing violence, and then together, Elder Roberta and I and a whole big team offered it tailored to Indigenous women. It was called Reclaiming Our Spirits. It's quite successful, and part of what we want to say today is that there are really positive ways forward that we can all take. And we just finished an RCT of that intervention, and women's health can skyrocket. Their depression can go down, their chronic pain can be lessened, their trauma symptoms can be improved. So at the same time, we've also turned our, and I'm going to tell you a little bit about this, turned our work on equity-oriented healthcare into an intervention to use at the organizational level. And we're just wrapping up a study that we've done together around emergency units. So I'll share just a tiny bit about that, hoping to whet your appetite. So I think we thought perhaps we'd start with what we know, which is, you know, there's a lot that we know, and I don't think you need me to repeat it, but I'm just summarizing what, you know, what we think we know. And you know, we know a lot about intergenerational trauma, and we know a lot about trauma and violence. And the first thing is that trauma and violence are pervasive throughout our societies. And, you know, I was just looking at a colleague of mine just presented this morning, I think it's 35% of adults have experienced child maltreatment of some form or another. And that's enormous. So, you know, this business of screening, that's not necessarily helpful. We need to be trauma and violence informed throughout our entire systems. We know that the effects are cumulative and that they build over time, that multiple forms of violence and having more over time has greater impacts. We know the effects are physiological. They aren't just in people's heads, for example. And we know via epigenetics, that intergenerational transmission is not just something that occurs because of social experiences, but rather the experiences changes our genetic makeup, so that generational transmission is not just about, you know, a person didn't experience good parenting, therefore they don't have those role models. It's far more complex than that. And as I said already, healing, structural change, better practices, they're all right within reach. I'm just going to pause there and say, Dr. Elder Roberta, would you like to jump in with anything that I've missed to this moment?
I'm okay for right now, Colleen.
Okay, I talk fast, and so you never know if you're going to get a chance to speak. Thanks. So this is, I'm just saying a little bit more about what we very clearly know, that, you know, brief, less personal forms of trauma may have less impact than prolonged interpersonal, structural, and systemic violence. So the impacts can be quite profound. So when we think about, you know, I experienced this, that I had a stepfather who was very violent and had certain ideas about Indigenous children, and saw me as an Indigenous child, and experienced violence quite extensively until I was about 12. But I had so many protective factors: a great mother, a great grandmother, you know, always enough to eat, so many protective factors. And so I wasn't in that situation where there was trauma after trauma after trauma. And I think this is absolutely critical for us to pay attention to. I'll never forget talking to a sexual assault service whose model, the model that they had underlying their practice, was that somehow there's normal life, and then you experience a sexual assault and there's disruption, and then somehow you go back to normal, and or, you know, to a healthy way of being or whatever. And that's not what the case is for many people. People have been torn away from their families, experienced racism on a daily basis, and so on and so forth, have multiple forms of violence and trauma coming at them, which is what we're talking about when we're thinking about the impact of racism and colonialism on Indigenous people. So we also, I just want to emphasize the physiological. And, you know, if we could really help healthcare providers always keep in mind that the impacts of violence and trauma actually have multiple effects at a physiological level. People have all of these impacts. The difficulty regulating emotions, you know, the impacts on your ability to concentrate, your ability to learn, the learned mistrust, and so on. People bring all of these things to their healthcare encounters, and yet we expect a certain level of behavior from people and aren't necessarily well prepared to provide care for people who have had horrendous experiences over their lifetimes. I think another thing is I wish that every healthcare provider, when they see any kind of chronic condition, could start linking back to the impacts of violence and trauma. So, you know, this young person gave me permission to use her photo, and just was just a living proof of the tremendous impact that racism, colonialism, and multiple forms of discrimination, stigma, violence have on people. And each one of these things you can link back to the impacts of violence and trauma, including intergenerational impacts. And yet when we see people with arthritis, with chronic pain, and so on, we aren't always making those connections. So that's part of what I hope you, if you don't already do that, you'll go away from today thinking about. So there's so many things that we can do. There's so much, and there's small things and there's large things. So you know, what I was saying, like, could we not let our land acknowledgements just become rote, where we say where we are, but not really what that means or what our commitment is to go beyond that, particularly those of us who are not on our own territories. Some of you are, and that is a different set of consequences. I think that really positioning ourselves, you know, I hear around tables people are self-identifying, but not necessarily taking that toward, well, what does that mean for my actions? And I also see that that I personally, anyway, need to interrogate my privileges and see how I can use those. I would say that all of us around this Zoom have some forms of privilege. We speak the dominant languages, we have employment, we have so much, and yet, you know, often there's a focus on the negative experiences. The business of partnership and true allyship is really important to me, and you know, I'm so happy to hear about patients as partners. And you know, I've been working most recently with folks who lead with their experiences of substance use stigma. At first it was experiences of substance use, but substance use isn't usually the problem. The problem is the substance use stigma that drives people away from care and creates so many barriers to support and help. So they lead with those experiences, and quite frankly, they're angry at being dismissed and at being tokenized and so on. So how do we get that true and meaningful partnership? Working with Elder Roberta over the years, you know, I see that she is somehow expected to contribute her time. There's no necessarily a pension for a person who's doing the incredible work that she does, going from place to place, hospital to hospital, supporting people, guiding us, and so on. And yet the structure has not caught up with the needs. So how do we get to true partnership and true allyship? And I say, let's make sure it's all in the budget correctly. So we've got a few other things that we think can be done. I think I've mentioned a number of them, but I think I'm going to expand a little bit on these ideas of what it is that's keeping colonialism and racism alive today. And first of all, I'm going to say it's how we set the individual level. And of course, individual level is really important. Individual healthcare provider to patient is important. Are you hearing me okay, Kendall? Yes, okay, thank you. But I think we need to be looking at how policies are shaping people's lives. And I mean that in every individual encounter. So when we provide care to people, are we paying attention to how the circumstances of their lives have led to their health and healthcare experiences? And are we paying attention to how healthcare is so fraught with efficiency discourses and the dominance of biomedicine and corporate efficiency and so on? Those are the things that we need to undo to allow ourselves as healthcare providers, workers, leaders, and so on, teachers, to really make some significant headway. So I just want to point to what I think is keeping the status quo in place. These are some of the things, and you know, we have not just racism on an individual interpersonal level, but it's the entire structure. And you know, we're fond of pointing out that St. Paul's Hospital looks like a residential school. And so, you know, helping people to imagine, what is it like for somebody who attended residential school, or whose family members attended residential school, or who had a residential school in the middle of their community, like for example, Alert Bay? What's it like to even be able to walk into St. Paul's? So we have, and you know, we've had horrendous examples in Canada of where this has led to death and really horrendous consequences. And I think at the root of it is often this individualism, where we focus on making individual people responsible for their health and healthcare without really looking at the circumstances of their lives. So I'm going to say two more things and then ask Roberta if she'd like to jump in again. I think that often we're using the kind of bad apples understanding of racism and of violence, as though bad actions are just the actions of individual bad people, rather than an entire system that keeps things in place. And you know, this author Zizek talks about violence. You know, we tend to look at the spectacular forms of violence that erupt, and we look at the really bad examples without understanding that actually it's a pervasive feature of society. So, you know, we have, for example, our child welfare systems have often gone from Matthew Vaudreuil, for example. We had an eruption of a really horrendous situation, but it was treated as an individual problem, and individual people were pinpointed rather than looking at what are the structures that keep it all together. We have this pull toward culturalism. So we keep sort of focusing on the exotic features of people's cultures and using culture as an explanation for their practices, their ways of being, whatever, rather than looking at the, again, the wider determinants of health. And just to use smudging, this is a picture from the research that Elder Roberta and I did with Indigenous women to support them after they'd left abusive partners or when were with abusive partners. Smudging is a good example. Is, you know, if we had open, patient-led, not patient-centered, patient-led kind of healthcare organizations, then smudging would follow. It's not just a matter of making a space for people who want to smudge. It's creating safety and the conditions for people to express what they want to have in their healthcare and what's important to them. And so, you know, we have a little bit of a one and done. You know, we've got this in place, so we fixed the issue, rather than really examining how are we structuring healthcare. And so, just on that note, you know, I think my colleague Annette Brown has really made the point from her work on the Brian Sinclair inquiry and the Joyce Echaquan inquest, that we have all these horrendous discourses that just keep it in place. The discourse of colorblindness, the discourse of fairness, the discourse of treating everyone the same. And when people say to me, "Oh, we treat everyone the same," I say, why would we want to do that? That's really not a helpful thing. Not everybody needs the same. So, Roberta, before I go on to these sort of last kind of key 6 points, is there anything you'd like to jump in with this moment?
Yes, thanks, Colleen. Just reinforcing what Colleen has shared and that we both share in our work together is that what needs to change here is, and I doing my work with my beautiful sister and brother elders in interior health and Indigenous cultural safety training and humility, Elder Chris Marchand and her husband, Elder Eric Mitchell. Elder Eric's teaching, and he's given me permission to share this, about the first step is finding out the first peoples of the land in which you live, work, and play on. The first step is to find out, if you travel to your work, finding out the first peoples of the land in which you work on. And if you travel and within Turtle Island, finding out about the first people in which you travel to and you're visiting and playing on. And Elder Eric shares very, very gently and with a little bit of humor that if you don't know how to start this journey of learning of the first peoples of the land in which you live, work, and play on, that Grandpa Google is a very, very good friend. You could go on to Grandpa Google and you can find out so much information. So that's the teachings and my beautiful sister and brother elders from the interior. And the other point that I wanted to put across is that do your piece, do your work, search out. It's not my history. It's not your history. It's our history together in this country we call Canada. So very, very important for you to do that work and not depend upon an Indigenous person to share that work with you. So to do some of your own homework, and then accept the truth that has been, that the truth of what our Indigenous ancestors and relatives have experienced since Canada formed as a country, but prior to Canada being formed as a country too. The other point I just would like to share is that the recommendations that I and other elders give folks and organizations is around that restructuring. Do an audit and evaluation of your funds, move those funds around so that you can welcome Indigenous elders after training and education in Indigenous cultural safety and humility, and move the funds around in your organization so that you have those funds available to support having an elder in residence or having knowledge keepers come in to share their teachings with you. And so really looking at the finances in a good and positive way. For all organizations, and especially bigger ones, us elders really share some recommendations to really have a very, very good look at job and role descriptions and how we can welcome the hiring of not just Indigenous people, but all people of color and nations. So not to get away from what we call the status quo, where there's very maybe one or two within a whole organization that is of color, to really looking at job and role descriptions and really decolonizing that process of how we bring people on. Like we have worked with a lot of people, in my own self and Colleen having had that lived experience, and to really welcome those folks who can contribute and share the work compassionately with the people. And I think that's the way you can build trust on looking at exactly what is, like there's multiple health issues, like we saw the beautiful photo of the young woman. And often, as I've heard in my own self and my own history, if I face attitude at the front desk, I face attitude from the doctor, I don't feel like sharing exactly what my pain is. And I won't share anything at all, and I'll go away with that pain until I end up in emergency. It's happened several times in my young life because of the attitude or the dismissiveness of what you're trying to share. It's all preventable, everyone. It's all preventable. And speaking of the history that has happened to our ancestors, and I thank everyone who's in all the hospitals that I go into in the Lower Mainland. I thank everyone who is supportive of Elder Roberta when I go in to take care of the patient in the bed or the family that might be able to be with the patient, and maybe if they're not with the patient. But what I really see, I have a lot of compassion. But when I am sharing ceremony for our beautiful young ones, we're losing all of our treasures, our young ones, in so many different communities all over BC, all over Canada. A little strip of white hot anger flashes through me, because when I see that young one before the young one is going to be disconnected from life support, that flash of white hot anger, I see the direct relationship from the residential schools and the policy of the federal government taking that young one's life. So this is why I encourage everyone to do your work, find out the history, and it's not for you to own, as in shame or blame, but for you to own and open up your heart with compassion and maybe change your attitude and your ways with the people you give service to in all of the hospitals, all of the clinics, everywhere. OCM, OCM. Thank you. Thank you. Back to you, Colleen.
Thank you. Yeah, I think that's exactly, if every one of you, and you are joined with us, we know that, if every one of you could help others see those connections, so that when somebody is coming with, for example, an overdose, that those links are made, that this is seen as a failure, not of that individual, but of our entire system. So I have 6 points, and then I wanted to just give some suggestions as to how we might proceed. Point 1, this idea of violence and racism as structural. Point 2, and this is with permission from the Sanyas training, this visual. We have to think that every time we see something on the surface, but behind that are organizations and entire systems. Point 3, these one-off responses to just racist incidents, whether they're at a national level or whether they're a complaint within your organization, the one-off response is not sufficient. We have to shift our systems. Point 4, we have to be talking about wealth and privilege, how we are protecting professional privilege, protecting professional power, and so on. We've got to bring that into the analysis of how racism operates in healthcare. Point 5.
Colleen, if you hear me, we're having audio trouble.
Safety training is really important. It's necessary, but it's not sufficient. We have to get to the so what, to the organizational things that are required. Yes. I'm going to spare you my face. Can you hear me better now, Kendall? Sorry, can you hear me at all?
I can hear you better now. Thanks.
Yes, you're hearing me now. Okay. Thank you. So the point 6 is we've got to tackle things at all levels. As I said, cultural practices and making space for cultural practices are really important, but we have to change structures. So we wanted to offer you the approach that we've derived, and this is Dr. Elder Roberta, myself, and a very large team, about how do we proceed to promote equity. We believe we cannot have cultural safety without being trauma and violence informed, and I think that's totally obvious to you all. And we believe we can't do that without having a harm reduction approach to substance use. In fact, we want to promote the idea of substance use health. And so we have developed these 10 strategies that we think are adaptable to any organization. And this is all totally available to you. What we have been able to show is not that our intervention, we did this in primary care, our intervention really didn't make that much of a difference. But when patients thought that their care was equity oriented, when it was culturally safe, when it was trauma and violence informed, when it was emotionally safe for them, we could show really important, significant improved outcomes, quality of life, chronic pain, depression, and trauma symptoms. So, we have evidence that this really matters. It really matters in terms of health outcomes. And I'm just going to share one little finding from our study that we've just completed with Emergency. We partnered with Paul's, UHNBC in Prince George and Surrey Memorial. And I'm just showing you the one, I'll just show you one significant impact that we had. But before I do, I just want to say what we did was we catalyzed direct care providers to make change. And what you see is a beautifully transformed the waiting room for St. Paul's Emergency, which was completely transformed, but not just slapping Indigenous art up on the wall, rather in collaboration, partnership with guidance from local Indigenous leaders, from the Indigenous liaison team, and with Indigenous artists. So doing it in ceremony. And so, you know, these kinds of changes really can make people feel differently about coming to healthcare, differently received. And this is the one significant finding I'm going to show you, and that is the number of patients who leave without being seen in all of these emergencies are huge. They leave without care completed, and we believe this is an equity indicator. You know, the rhetoric is, oh well, people just show up who they aren't that acute, they aren't that sick, and so they go away without being seen. But in fact, we think that there's another entire group of people that go away because they don't feel welcome, because they have nowhere that they can go to have a smoke, for example. They miss their turn constantly because they have to attend to other things. And we showed that during, now this is not all due to our intervention, but it aligned with a lot of other work that was being done at St. Paul's. So we managed to reduce the number of people that left without their care completed. So we're trying to take all of this work and turn it into something that you folks can all use wherever you're, don't care where people want to start. If you're willing to tackle Indigenous specific racism toward cultural safety, that's great. We've got an action kit for you. But it's also going to draw your attention to the importance of trauma and violence and substance use discrimination. You know, many Indigenous people, whether they drink alcohol, use drugs or not, completely not, they still experience substance use discrimination, and that's, you know, that's gotta change. So we're trying this in relation to a whole bunch of different contexts, and we would invite you to take up these things, these tools, these action kits yourselves in your organizations, in your teaching, and so on. So we've got a whole bunch of stuff that is that will be continually adding to e-learning modules and animations and infographics and tools, all sorts, to help impacts, colonialism and racism, the historical and the ongoing impacts can be attenuated. So I'm going to turn it over to Roberta to invite your thoughts, and then I know that I think Kendall and Sherry, you're going to moderate for us, right?
Yes, I will, but certainly after we hear from Elder Roberta.
Thank you so much, Colleen, and thank you, Kendall. Thank you, everyone, for listening. And I just want to share that the importance and the structural change that I'm witnessing within Vancouver Coastal Health, and how they've opened up their hearts and really welcomed our beautiful, beautiful leader, Leslie Boncher, as the Vice President of Indigenous Health, and how St. Paul's has really transformed. This comes from the top down when you really welcome Indigenous ways of knowing and doing. And we now have a beautiful, we've had a beautiful Vice President of Indigenous Health, Harmony Johnson, over at St. Paul's. And the past couple of times I've gone to see our beautiful community members, I was just really, really uplifted in my heart and spirit that there's not two people that are just dragged in so many places and worn out completely because they can't meet. But now Harmony and Neil and all the beautiful people at St. Paul's are building that team so that it's growing. This is what we need, is more of our people taking care of our people. I just have to acknowledge the work that is going forward in such a good way by welcoming our Indigenous leaders to be involved, and our beautiful Janice over at Vancouver Coastal Health being the lead for Indigenous cultural safety, training and education, and so many ways. These are the ways, everyone, that we can really reach the people who leave without being seen, who don't tell you what's exactly wrong with you when you came in to see them. This way, when we welcome our people to be amongst the people that are on the team taking care of the patients and the families. OCM, thank you.
Excellent. Thank you very much. I recognize it's almost 1 o'clock. Some of you may have to leave at 1. Our first question was at 12:36, so we'll certainly dial back there. And any additional questions, please put your comments and questions on the chat. But 2 quick things. Holly was asking, would the slides be available? I know that this session is recorded, and so you will be able to go through this recording and see all the slides. But Colleen, what do you think about slides?
Yeah, I'm going to take out my one significant finding because it'll be embargoed for publication. But other than that, I will send them to you to share.
Excellent. And a very close point with that, Colleen, there was a question about your point 5. Cultural training may not be enough. Do you mind repeating that point on point 5?
Yeah, I think what I said was it's necessary, but not sufficient. And when we found in primary care settings that, you know, people were at all different levels, and we had Indigenous staff, non-Indigenous staff, and so the training meant different things to different people. But what really mattered was the interprofessional conversations where we brought the medical office assistants and the physicians and the social workers and the nurses all together and had those conversations, and we're able to say, so what for our practice? We've got to get to the so what changes are needed, because individual healthcare providers or, workers cannot make the changes alone. So that's what we mean by that. It's not enough, but it's necessary, but not enough.
Excellent. Thank you very much. And so for those who may have leave, thank you very much for joining us. In the future, we'll be doing these rounds. Our next one will be in January. So if you are interested, please let us know. We'll certainly get back to you. Let me go right to the questions now. At 12:36, A. Godding asked, thank you for the question. Is structural violence also seen in law enforcement? So welcome some comments there. And also, Sherry, thanks for sharing the CBC documentary on this piece. Elder Roberta and Colleen, your thoughts about structural violence in law enforcement?
I'm going to go ahead, Colleen. And yes, in every system coming down from the federal and provincial levels, there is so much structural violence and inequity. And just following through with that, I'm involved in a couple of research studies through the School of Nursing with Dr. Helen Brown in people who've experienced the justice system and the inequity against, especially like all peoples, but especially against Indigenous men and Indigenous women within the system, and people of all identities, especially really, really, really punished. So yes, in every system there is structural violence, and there's that trained, where I feel that where we can undo the structural violence is go at the schools of training. Having been involved with the School of Nursing for close to 2 decades, being involved with the School of Family Medicine, and having been involved formerly with the School of Social Work, actually talking to those that are on their learning journey. So where we need to go again is through the justice to educate those people in their educational learning journey, because they go into that and they're taught a certain way and they're taught a certain attitude, and they carry that attitude that brings violence upon all people, but especially upon Indigenous people, and especially upon people of all identities. OCM. Over to you, Colleen.
I don't know that I can add much to that, except to say there are beacons of light and hope. And I had the sorry, I've got to turn my video off. I had the privilege of working with he's not a constable, corporal, who's now at the Quadra detachment. And he is RCMP and modeled for me what exactly it looks like when an RCMP officer takes cultural humility seriously. And he said to me, he moved from Kwakkaluk territory and had a lot of difficulty learning the new dialect. And I was like, you as an RCMP officer are learning the dialect. And so he said, I don't deserve, please don't give me credit as a white male who's been positioned to exactly enact colonial enforcement. Don't give me extra credit, okay? That's the least I can do. So there are beacons of hope, but absolutely, as Roberta has said, this is an area that needs very significant attention for sure.
Excellent. Thank you very much. At 12:39, Meninder, I apologize if I have misread your name, but really appreciate your question. So thank you very much. The comment is that the dominance of individualism resonates with me. The focus of self-care and behavioral changes can become so frustrating at times. Welcome your thoughts. I think at that point you were talking about system and individuals interacting also. And so the issue of individualism came up. Welcome thoughts there, Elder Roberta and Colleen.
Roberta, do you want to start off?
Sure, thanks, Colleen. And that focus of individualism comes, I believe, from colonial practices, patriarchal societies, and has really moved. Like, as I share many times when I'm speaking with in circles within the schools, is that it was very difficult to survive thousands of years ago. If we went out on our own and thought we could do it on our own, we would not survive. We had to work together. We had to help each other. And as the societies came to Canada and they had their own ways of knowing and doing, and that competitive way of doing things, and I can do this better than you, and being ingrained from the top down, has done not any good for people. To be individual and to be alone is not our way of knowing and doing. For Indigenous people, it's like about how can we help you? How can we help you? As Elder Doris Fox from Musqueam and my dear sister Elder shares, we must always lift each other up rather than put if someone does something that is kind of out of order, what all my 30 elders that I work with, what they did is they role modeled over and over and over again. I do not believe, everybody, I would be here today without those 30 elders and those teaching. Like this whole concept, like my elders would teach me over and over again, and people have heard me say that Roberta, nothing is right or wrong. Nothing is right or wrong. It is who is your teacher, how you accept those teachings, and I put my hands on my heart, and how you carry them on. Nothing is right or wrong. So that is, that trying to undo hundreds of years of that individualism and that I'm better than you and all of that, it's going to take all of us working together. OCM. Over to you, Colleen.
Yeah, I think this manifests in so many different ways. We're coached to competition and individualism. So all of us around this Zoom, we're encouraged to think of our success as our own. We're not encouraged to think of our success as a consequence of our parents and our grandparents and our teams and our friends and our partners and our children. We're not encouraged to think that. So we get sucked into this individualistic way of thinking, and then we blame and shame. We blame people for smoking. We blame people for their mental health issues. We blame people without even looking upstream. And we pay lip service to the upstream, but all of our systems are oriented to the individual. And then that manifests, I think, at the point of care, where we turn to family only as a relief to the healthcare system, rather than as a key resource to people. I personally believe that a relational understanding of health and well-being and our connection to the land and our connection to one another is actually the only way forward in terms of saving the planet and saving our health. So, you know, we sometimes exoticize Indigenous ways of knowing, but quite frankly, I think that the teachings are something that we desperately need at this point in the health of the globe. And I hope that doesn't sound too dramatic, but.
Oh, this is great. Maybe I'll make one more comments, and then I'll bring Janice in and welcome Janice, your perspective also on these questions. There's one comment, really interesting comment from Patty about the fact that, you know, sometimes we see system manifestation in even electronic health record in terms of language that we use in there and the type of information that we code. Your thoughts about electronic health record and how that may or may not, or does not perpetuate some of these challenges, and are there cultural consultants to look at actually programming languages? So I thought that was quite an important question for us to explore. Welcome thoughts there.
Roberta, did you want to go first, or shall I jump on that one?
Oh, you jump on that one, Colleen. Thank you.
Right. Thank you. Yeah, they're really important. I think every piece of paper that we have, every intake procedure, every chart needs review. And, you know, I have a simple activity that I get first-year nursing students to do. Sorry, my internet's bad. Where I just ask them to do an hospital intake form, intake history, and they find it so violating and, you know, so enacting of power. And, you know, even the way we greet people, you know, when people turn up at triage and the triage nurse or the clerk says, what brings you here today? In a you know, really super abrupt way. And it doesn't sound like there's anything bad with those words, but it can be very intimidating and off-putting to people. So I think that you're entirely right. This is so important, how we chart, what we chart, who gets to see the chart, what's in it, how we label people. You know, if you review charting from an equity lens, you know, it's very, very discouraging. So, you know, we need processes and we need accountabilities for all aspects of the processes and how we document them in relation to patient care, I think. Over to you, Roberta.
Thanks so much, Colleen. And even in the words, the importance of the words we use when we're interacting with a patient and a patient's family, you know, even the simple, like first visit or first walking into the room and you're asked, like, what's wrong with you? And coming in, changing the words that you use and how you speak is very, very important, because it can bring harm. It can put up the barriers up so that the communication will become not communication at all. So very, very important in how you speak, the tone of your voice, and the words that you use, and the descriptions that you use, especially as Colleen mentioned in the charting or in speaking with each other, and especially in front of the patient and families. OCM.
Excellent, thank you. Let me maybe invite Janice. I welcome your perspective and comments and thoughts at this point. Janice, your thoughts?
Thanks, Kendall, and thanks so much, Elder Roberta and Colleen. Wow, just so many rich teachings here, and I think just good medicine for everyone. I know that when we're training and supporting and teaching staff to, you know, be able to implement the ICS work, you know, within the system, that those that are having most success are focusing on right relationship and that partnership that both Colleen and Elder Roberta talk about, and you know, nurturing that connection and making space and allowing space and creating space for Indigenous people and voices. So, you know, those ongoing impacts that affect, you know, our body, our mind, our spirit, you know, those come out in health disparities. And how we access self-care and health services, which should be self-care. It's funny I said that because really, we want people to feel empowered to take care of themselves and come into the system and get what they need. And, we talk about the colonial disruption of our traditional ways. Since time immemorial, we had traditional ways of being and living and health and healing and wellness and all kinds of approaches that, thankfully we have our elders and knowledge keepers that bring that into our work now, like Elder Roberta. So in that, we need to turn that disruption around in everything we do, that we're, as we're doing anti-racism work and decolonizing practices, that we're disrupting the system. And really everyone has a role and some kind of power, privilege, or influence or pathway to execute that disruption in a good way, of course, as Elder Roberta would say, in a good way, right? And truly we are, all related. And we know, from our, many Indigenous teachings and teachings around the world of all people and humanity that we're connected, we're related, we need to take good care of ourselves. Individualism is going nowhere and helping no one. And I think we see that with all the problems and messages we have. So taking care of one another in the way we move forward and supporting each other in that journey of healing ourselves collectively in our communities and our work communities, and in implementing this work. It's early days, so I just so appreciate all the teachings today, and want to put my hands up and really say hachka to Elder Roberta, for your prayer and your blessings, the way you started the session and that you always do. That's our medicine, and that's laying the foundation for, this important work and the way we do the work. So I heard all those words that you shared, and of health, healing, wellness, harm reduction, protection, and many good things that, we can integrate into our intention of our work, and know that, no one's alone, right? And you don't have to have all the answers. And sometimes it's tough. The journey can be really tough, and people can take some hard knocks, and that's life, right? So we get back up and dust ourselves off and keep working on it. So I like Colleen had mentioned the interrogation of our privileges. And I know even myself as an Indigenous woman, it shouldn't be a privilege, but I do know that I'm very, very fortunate that I was raised in my own family, because those that, were taken to residential school, that are still taken into care, 60 scoop, so many reasons that people were not able to be raised in their own family with the love and care that every single child deserves, right? So I had that. I'm really fortunate. I was able to be raised in my territories throughout Surrey, White Rock, North Vancouver, to know the land that my ancestors were such amazing stewards and caretakers of. And so, it's a journey, and the patient-led, not just patient-centered. I love that. The integration of, and the, not just integration, but access to traditional healing medicines, ways, elders, knowledge keepers, we're working on that. And Elder Roberta, supports and guides that group of elders that does such amazing work within our system. So I'm just going to leave it at that, because there's just so much to say about this session that it's rich, and I hope that we'll continue these discussions. And I love that Grandpa Google Elder Roberta. That's the first time I heard that, but I'm gonna see Google in a new way. So for now, I'll say thanks everyone for sharing and great questions. I don't know if there's a few more that you want to.
Oh, there are quite a few more, definitely, Janice. And also, Gutting, thanks for acknowledging the importance of elders in primary care. So thank you so much for that comment. I want to go back to 1249. I think Sherry asked a question about the system piece. You know, the fact that in health system organizations, budgeting to ensure that we honor Indigenous knowledge through dedicated positions is one aspect of thinking about in the system. How can we look at this piece in moving us forward? Elder Price and Colleen and Dr. Varko, I welcome your thoughts about, you know, as an organization on the budgeting side, on the leadership side. What are your thoughts about how we can leverage that for helping us to get to where we want to go?
If I could just speak first, Colleen, and again, I point out the fact about the recruitment of our beautiful leader, Leslie Boncheur, to Vancouver Coastal Health from Fraser Health, and her leadership in going forward, her leadership in recommendations to Vancouver Coastal Health about the needs and the importance of involving Indigenous people in the healthcare system. And through her leadership, that has now affected HR and affected finance, and really being able to, as thank you, Janice, for your kind words to Elder Roberta, and as the elder in residence and lead elder of now our pre-COVID, we had close to 30 elders from many different nations from across Turtle Island, but certainly our 3 host nations represented there. And the work that Janice has done and Leslie has done, guided over Indigenous cultural safety training, humility, and education of the more than 10,000 Vancouver Coastal Health staff. I'm not sure how many numbers pre-COVID we were able to affect, but doing that training and education, involving the elders in that work, and then people would do this learning, and then if they were interested in having an elder in residence or knowledge keeper come, I, with the manager at Vancouver Coastal Health, would go and do an orientation, and I would go repeatedly until every single person in that place has received the orientation on how we respect and treat the elders that would be coming into the organization. So we have some very happy elders at Heatley, at DCHC, at Pender, at our Women and Children's program at Commercial and Broadway there. I'm not sure of the name of it, but really ensuring that the knowledge and the respect is learned by everyone in that process, and then bringing our elders in. So that wasn't a journey that could just snap your fingers could happen. There's a process to that, learning about who elders are and how we respect and take care of elders, and then doing an orientation for all staff, and always having that strong connection between me as the elder in residence and the elder that's in that organization, to ensure that safety is acknowledged at all times for the elder. So that journey, I really feel holding my hands up in honor and thanks to the leadership for Vancouver Coastal Health to open up their minds and hearts to welcome Indigenous ways of knowing and doing, and by further in action in this. And I just wanted to share, going back to our PowerPoint presentation as well, if I could just add in that is very important for each and every one of you to, in your learning journey, to read and look at the Royal Commission on Aboriginal People from 1996. The Truth and Reconciliation Calls to Action. The Missing and Murdered Indigenous Women and Girls and People of All Identities. Those recommendations, to read that report and those recommendations, and then tick off what recommendation has been followed so far. What recommendation? So that in your educational journey can help you, because there's certainly from the federal government a lot of lip service being done on all of these works going forward. So thank you for letting me stray off track there, but it just came to my mind that if people could do that as well. So I pass it over to you now, Colleen. OCM.
OCM. I don't think it was at all off track. I think that all of the answers, all of the direction has already all been there. It's just the political will, and I don't just mean at the big P level, but at our own level, the small actions that we can each take to enact those recommendations, which get repeated and built upon, but they're all really the same, and they've always been there. So I don't think that's off track at all. I did want to thank Janice for her words, and just a couple of things that you picked up on, Janice, that I would just like to emphasize. And that is that in our study of primary care settings and what made a difference in terms of people's care, it wasn't a direct relationship between people experiencing culturally safe, trauma and violence informed, harm reduction type care and having better health outcomes. It was in between, was people feeling confident and comfortable with the care that they were getting and the people who were looking after them. And then that translated into them then feeling way more and confident about what they were able to do in terms of their own well-being and care. So it's not just making people responsible for their own self-care, but that support of making people feel really confident and comfortable so that they could take that kind of control. And that translated into the better health outcomes. So I was really pleased that you sort of underscored that, and that you picked up on that idea of patient-led. And I just want to say that I see Nellie Gomez is online, and Nellie and Dr. Elder Roberta and I all learned about the importance of woman-led when we worked with Indigenous women who'd experienced horrendous levels of violence. If you're not woman-led, the women are actually going to vote with their feet. And I think the same thing when it comes to patients. We have got to move our entire system to patient-led, and I hope each one of you takes that forward. And back to the question of budgeting, it's about money and time. And I think I won't repeat what Elder Roberta has already said. Those are really important strategies, as are adequate health human resources. We have, over the past 2 decades or perhaps more, shifted a lot of our healthcare dollars into pharmacological interventions, biomedical, biotech, and information technology. And we have squeezed and squeezed and squeezed the direct care provision. And so we have seen increases in acuity and patient ratios, so that people who are providing direct care feel so squeezed. And time isn't the only thing that's needed. I'm very fond of saying it doesn't take more time for me to say, would you feel comfortable getting undressed, as it does for me to be Miss Bossy Pants and tell people just how to get, what they ought to do. But time is important, and our opportunity to engage with people face to face with compassion has got to be supported by adequate workloads. So I just wanted to say that. I'm off my soapbox. Back to you, Kendall.
Oh, this is great. Fantastic. Wow, time flies. We're only 6 minutes away, 5 minutes away now from the end. So really want to maybe one other question and then we'll wrap up. But really appreciate all the comments. There's a discussion about how Indigenous communities and commercial enterprises can also lead. Perhaps we'll explore that in a different day. So thank you for that. Suki, thanks for asking the question about what support's available for Indigenous patients in terms of counseling sessions, acknowledging their trauma, and also for primary care services where they may not have an elder. How should they approach that in those care? I imagine this is really at the clinical context, so welcome some final comments there. And by the way, people are really interested in the EQUIP training. And Colleen, if you can put a link there for people who want to access EQUIP, I think that'll be amazing. Elder Price, maybe could you start with that about elder in primary care and also counseling services for patients, and then I'll ask Colleen to wrap up.
Oh, thank you, Kendall. But I'm wondering if I could call upon you, Janice, to share, address this question.
Sure, absolutely. Yeah, it's a work in progress depending on where you're working, but definitely we have our elders in residence, as Elder Roberta shared, and patient navigators within the system. And a lot of that work is, building a relationship for staff to know where to connect and who to connect with, and build that relationship with patient navigators, with elders. And, that's an ongoing, journey, and something we're working on expanding on. And in terms of counseling, I think that, there's many organizations out there that are offering that, depending on the person and their needs, like the Indian Residential School Services Society and those type of organizations working really hard to provide those services within the health system. I know there's some services for Indigenous staff, to go through the kind of health and wellness links that are available. That's probably all I can say on that at the moment. So let's just continue to work on this and improve the accessibility for those supports in my relation.
Thank you.
Colleen, do you want to say anything?
We keep hearing this is the most important thing in the world, but I only have 15 minutes. Beyond counseling, I don't think Aboriginal patient navigators should be necessary. I think the system should be safe for everybody. But, we end up putting so much burden on people. You have an entire hospital with one navigator and so much put into that. And I say follow the money. If you want to see what the true values are, follow the money. So the points about budgeting are really critical. So I'll just stop there. Thank you very much.
Great. Thank you. We only have 2 minutes left, so I really want to first thank everybody. This is just an amazing session. I learned so much through the exchange, but of course, I want to thank Dr. Elder Roberta Price and Dr. Colleen Varko for leading such an excellent discussion, and also so deeply able to allow us to explore this. And even when I say deeply, we only got 1.5 hours. I know we can go a lot deeper than that, but thank you so much for starting us on this journey to move forward. I want to thank you. I want to thank the Vancouver Coastal Health Indigenous, the Aboriginal Health Unit. I want to thank First Nations Health Authority. Of course, I want to thank Ministry of Health, and maybe Sherry, I'll invite you to maybe say 1 or 2 words before we wrap up. I also want to acknowledge that Vancouver Physician Staff Association for their support in allowing us to participate and support these rounds. And with that, Dr. Mike Norbury, Dr. Jay Slater, and Dr. David Hall to also join us in planning these sessions together. So I want to make that acknowledgement. So Sherry, let me pass it over to you.
Thanks, Kendall, and thank you, Elder Roberta Price, Colleen, and Janice. Very much appreciated. I will, in fact, learn more. I have been reading. I will learn more. You're right. Thank you so much to everyone for participating, for making this an important way that we can all learn and move forward together. Thank you.
Thank you very much, everyone. I hope you have a wonderful Friday afternoon and slide into the weekend, and lots of reflection and rest, and hope you're safe and health. Thank you so much, everyone. Bye-bye.
Kendall, one more document. I forgot. I'm working hard on that. In Plain Sight, the recommendations from In Plain Sight. And even if you read the summary. So awesome to everyone for listening today. Thanks so much, Kendall, for moderating. Really appreciate. OCM, thank you, Colleen. Thank you, Janice. Thank you, Sherry. Thank you, everyone who's been on the Zoom here today. OCM, have a good afternoon. OCM.
Thank you so
Thank you.
much. Take care, everyone.
Bye. Bye.